All right, today we're going to dive into the thyroidectomy. It's a surgery that removes a tiny gland that, believe it or not, has a massive job. We're going to look at why it's sometimes necessary, how surgeons pull off this super delicate operation, and what life is actually like when your body's master controller is, well, gone.
So let's just start with this question. We all have this tiny but incredibly powerful gland working for us every single second. But what happens when it has to come out? What changes?
To really get the surgery, first, we've got to get to know the main character in this whole story, the thyroid gland itself.
Okay, so picture this. Right at the base of your neck, wrapped around your windpipe, is this small, butterfly-shaped gland. The best way to think about it? It's the master thermostat for your entire body. It literally sets the pace for how you use energy. And its job description is huge. I mean, it's not just about energy. The hormones it makes are absolutely essential for everything from your heartbeat and digestion to muscle control and even how your brain develops. It is a tiny gland with some seriously massive responsibilities.
So you hear all that and you think, wow, that sounds important. Why would you ever take it out? Well, let's get into the common reasons. You can pretty much boil them down to three main problems. It's either overactive, it's obstructive, or it's cancerous.
First, the gland can just go into total overdrive. It's a condition called hyperthyroidism. Basically, your body's thermostat gets stuck on high, and you start burning through energy way too fast. That can cause a ton of problems, and sometimes the best solution is just to remove the overactive gland.
Other times, the problem isn't what the gland is doing, but just how big it's gotten. It can get so enlarged, which is called a goiter, that it literally starts to squeeze your windpipe. And as you can imagine, that can become a serious problem that makes it hard to even breathe.
Now, a very common reason for removal is, of course, thyroid cancer. When doctors find malignant growths inside the gland, surgery is usually the #1 treatment to get the cancer out and stop it from spreading anywhere else.
And there's a related, though not as common, issue called thyroid lymphoma. This is another kind of cancer that hits the gland, causing it to swell up, often pretty quickly, and usually requires surgery to fix.
Okay, so we've pretty much covered the why. Now let's step inside the operating room and really understand the how by taking a step-by-step look at the procedure.
You know, what seems like a really complex operation can actually be broken down into 5 main stages, from getting the patient ready all the way to that final stitch.
It all kicks off with really careful preparation. The patient is positioned perfectly to give the surgeon the best possible access. Then, a super precise incision is made, and they usually try to hide it in a natural skin crease. The goal here isn't just a successful surgery, but a good cosmetic result too.
Now this is the trickiest part of the whole thing. The surgeon isn't just taking out the thyroid, they are navigating a really delicate landscape. Their main mission is to protect these tiny little glands called the parathyroids, which control your calcium, and the recurrent laryngeal nerve, which, get this, controls your vocal cords and your voice.
And that delicate work really brings us to the core challenge of this operation, making sure the patient is safe by managing all these risks in real time.
So surgeons are constantly thinking about these potential problems. The big ones are, you guessed it, injuring that laryngeal nerve, which could affect your voice, and damaging those parathyroid glands, which could throw your body's calcium levels all out of whack. So that's the key question, right? If the risks are so specific and everything is so tiny and delicate in there, what tools and techniques do surgeons actually use to meet that challenge? One of the most important tools in their kit is intra-operative nerve monitoring. You can think of it like a proximity sensor. It gives the surgeon real-time electronic feedback that helps them find that nerve and, more importantly, stay away from it during the procedure.
Okay, so the surgery's done, it was a success. But the patient's journey is not over, not by a long shot. So now let's explore what life is actually like after a thyroidectomy, what the new normal really looks like.
Recovery really kicks off with some clear education. Patients get a crash course in how to care for their incision, why it's so important to rest their voice, and how to manage their new medication schedule for those thyroid hormones and maybe calcium too.
And this right here is the single biggest change. Without the thyroid, the body doesn't make its own hormones anymore. So a daily pill is needed to replace that function. It basically takes over the job of that master thermostat to keep the body's metabolism in balance for the rest of their life.
So the procedure can take a condition that is just debilitating or even life-threatening and completely transform it into a manageable new normal. And it's all thanks to that small, daily pill. Ultimately, the entire process from the moment of diagnosis through the surgery and into that lifelong management, it's all driven by this one idea. It's about so much more than just removing a problem gland. It's about restoring a person's health and their quality of life.
And that leaves us with a final, really remarkable thought. The thyroid is this incredibly complex manager of our body's systems, and yet, medical science has somehow found a way to replicate its essential, lifelong function in a single, simple pill. It's a true marvel of modern medicine.